For almost 30 years, the Injury Center has really been the leading place for violence and injury prevention. And over that time, we have put out guidance, evidence, best practices, and really moved the field forward for what public health can do to prevent suicide, overdose, violence, as well as other unintentional injury topics.
Many people have been impacted during the pandemic, and it's a really opportune time, I think, to look at where we can build resiliency, how we can prevent this. Never has there been more a pivotal time to be involved in public health. The Injury Center has 3 key topical areas: adverse childhood experiences, overdose, and suicide. These priorities are really important because they intersect. You look at trauma a child experiences. This can lead to problems later in life, such as suicidal ideation or drug use. So it's really a big circle. If you can prevent one early on, you can prevent the others.
ACEs, or adverse childhood experiences, are preventable, potentially traumatic events that occur in childhood. And they include things like child abuse and neglect, whether that's physical, emotional, or sexual abuse or neglect. And a lot of household challenges, things like unmanaged mental illness in the home, or losing a parent to overdose or to suicide, or to having a parent incarcerated. The most important and exciting thing about ACEs is that they are preventable. So we have a strategic plan. Our strategic plan involves first ensuring that we have the best science available. The second aspect of our strategic plan is ensuring that our partners have all of the tools they need to put that science into action. So whether it has to do with technical assistance or building resources to turn that science into a programmatic strategy or communications and policy tools with their partners, we want to make sure that we're listening to our partners to understand what their needs are and building those tools to be responsive.
Serving on CDC's COVID response has really highlighted for me how much we are all here, all of us who are CDC staff are here for public health. By understanding the impact that school closures have had on children, on families, on communities, we know that, for example, in the area of injury and violence prevention, teachers and schools are often the first to notice when children are slipping through the cracks, when there may be problems at home, and who can provide those critical referrals for services. Through the response, we've been able to really provide supportive tools and resources and guidance to schools on ways to reopen safely and to be able to provide those services to children.
COVID-19 has really changed the game. The numbers that we're seeing in our preliminary data indicate we have a really grim outlook coming. The isolation that we have seen in communities that we as scientists ourselves have experienced, we're seeing play out in an increase in overdose deaths and overdoses. And so we have an entire division devoted to helping both our states and city colleagues work with their programs to reduce overdoses, from both clinical practice with our CDC guidelines to surveillance, actually monitoring the drug trends and making sure that we're both responsive to new trends, but also then tying that to prevention activities, making sure that we're looking at those trends and then tailoring our prevention activities in a way that addresses the changing complex nature of the opioid epidemic.
When we think about suicide prevention, we're really working to address the spectrum of risk factors that contribute to suicide. Some of the work that we do is focusing on programs that help build resilience, social-emotional learning skills, so individuals know how to handle conflict or stress. But we also focus on bigger issues like economic supports and reducing those stresses that happen in a household, in a family, or community that we know can also contribute to suicide risk.
Successful collaborations are a cornerstone of the work that we do here at CDC. We can't, have as much impact if we don't collaborate with the right partners at all levels. In terms on a more programmatic level, though, we do encourage our recipients to use that community-led lens to help inform who needs to be at the table, to help assess who's missing from the table. And then for those partners that they already have some sort of relationship or have previously engaged, looking at additional ways to maximize those partnerships or improve the way that they're working together.
In addition to being in the middle of a pandemic, we also had a huge social justice movement that really forced us to look more closely at within our center and at the work we were engaging in. And so we embarked upon a climate assessment to get a better understanding of how to support our staff, as well as how to support our scientific and programmatic work. My hope is that we can fulfill our mission of everyone, everywhere, every day safe from injuries and violence. That is the ultimate goal, because if we can fulfill that mission, we really can address inequities across the board.